going to ask Slade from ASCD, in charge of the global outreach for ASCD, to tell us what he thinks about the impact of the question of the crisis on the future of education. So, Sean, what will gonna change in the future?
Thank you. Thank you very much, Didier. And just so people are aware of the talk that I'll be presenting and where we're coming from, ASCD is a global education association based in the US, in the Washington, DC area. And so we're talking about COVID-19 as it pertains to schools and education. And I think a lot of what Nicola was outlining in her talk is going to be repeated. And just to, before we move on to the next slide, just to answer the last question about disadvantaged students, I think it's key that we all understand what our locus of control is. And so for the teachers and the educators, yes, there is a myriad of things that we need to address or would like to address, but there are certain things that we have control over. And the best things we have control over, as I'll start to illustrate in this talk, is maintaining relationships with our students, developing and enhancing sense of belonging, and building that community, because that will start to be a protective factor against some of the traumatic effects of COVID-19. Next slide, please. So really, I'll start off with a summary of what I'm talking about and what we're getting into and what we're seeing via this crisis is really our own Maslow before Bloom event. And what we mean by that is we need to think about the hierarchy of needs that Abraham Maslow outlined before we start thinking about the taxonomy of learning that Benjamin Bloom spoke about. And so it's an understanding that we need to focus on student and family and community and educator well-being, health and safety before we start to worry about cognitive development. And if we don't, we're going to be hamstrung and held back. Next slide, please. So what I want to talk about in the next 10 minutes is really just some of the strengths, but also some of the issues that are coming out of this crisis that we're seeing from a K-12 education perspective. Next slide, please. And there are things that we can weigh up on a scale. There are strengths that we're seeing. There is a desire for normalcy. We're seeing a desire and a need for community being developed. Well, one thing that's a very strong positive as well is we're seeing this understanding in the majority of schools and districts and countries for expertise, whether it's expertise around health and well-being and advice from the Centers for Disease Control or the health departments in various countries, or even an understanding from parents and community about the expertise of teachers themselves and what they are doing. But one of the strongest things that we're seeing in terms of strength is an understanding that well-being is critical to an effective education and an effective education system. However, we're on the flip side, we're also seeing growing levels of anxiety. We're seeing increased vulnerability, especially from those communities who are consistently disadvantaged. And we are also seeing the effects of students and teachers and families coming from trauma and varying levels of trauma. Next slide, please. So focusing on, we'll focus on well-being and we'll focus on trauma. But one of the positives that we're seeing coming out of this crisis is this understanding that well-being is a critical part of education, that there is a universal reappreciation of the need to focus more on both our individual well-being, but also the collective, the community well-being. And we've seen this, whether it's via the opera singing in Italy, or whether it's the applauding of the health workers in New York, or more recently, you know, watching the English Premier League and the affirmation of thanks and reward to the National Health Service that's going on. There is a universal understanding of well-being and support. There is also an understanding from teachers themselves that well-being is a critical part of what they do. And it really needs to be pushed to the front of the educational priority list. Next slide, please. And we've seen examples of these things across schools and districts, especially here in the US, whether we've had drive-by parades where teachers or families are supporting students who can't get out of their houses, or teachers who are locked away. There is this understanding and this need, almost a human need, for a sense of belonging and a sense of security. And this has been pushed not only by teachers, but by families, by parents, but also by the education support professionals as well, who very often have been the frontline people handing out meals, serving students, going door to door to make sure that students are understanding what services are available, or making sure they have access to internet or other devices. Next slide, please. We've seen examples, and I'm sure there are more and more around the world, but at least in the US, examples of schools who have been reorganizing their schedules to ensure that students get meals throughout the last couple of months when the majority of schools have been closed down. There have been affirmations from athletic departments turning on their lights to support the graduates for 2020. There have been these collective actions by students themselves who have been posting online choirs and online presentations. And this is a summary from one of our authors and former emerging leaders, that just in this sense of anxiety and this sense of apprehension that we've all been experiencing, that teachers are skilled and they are the pedagogical experts to make sure that the students will catch up as best possible and when possible. But what we need to focus on initially is making sure that we try and minimize the effect of trauma, which is affecting our students and in fact infecting all of our school communities. And so even putting out these messages of support and messages of alignment, just to let people know that we are the experts and we can help get students back on the learning track. Next slide, please. But on the flip side, as I mentioned, we're also, and it's almost this mirror image that Nicola was talking about, as we start to boost up well-being, we're doing it as we're also seeing the effects of trauma not only increase, but also broaden across our communities. Next slide. And what's different about this crisis is that we've had trauma and we've had issues before, whether it's acts of violence in schools, or whether it's earthquakes or natural disasters or hurricanes. But this is a crisis that is affecting everybody. It's not just affecting one school. It's not just affecting one group in the community. It's not just affecting the students. It's affecting everybody. And that's why this is going to be so different when schools start to reopen next month, at least in the US, or the next 2 months. And I also want to reiterate that we have had teachers and educators and education support professionals and public health and school health providers on the front lines for the last couple of months. And these individuals and these sectors have themselves been going through trauma, have themselves been had people in their families who they've lost, or they themselves have become sick. Yet these are the people that we are going to turn to when schools reopen to try and help our students to reacclimatize. And so we are going to see this swell of trauma as we start to re-enter schools. Next slide, please. And so going back to what I was saying initially about what are some of the things that we can do. As an educator, we can provide advice or direct people towards the health professionals. But there are certain things that we as educators can do ourselves that to try and minimize the effects of trauma. Now, fortunately or unfortunately, we have some experience in dealing with trauma. And so we can go back even last October before this hit the majority of the world, we were putting out articles about how to deal with trauma in schools, and that was isolated incidents. And if you look through the list there, it's about providing structure, it's about providing safety, it's about providing things that students and teachers can cling on to. It's about developing relationships, but ultimately it's about going to the well. And what we mean by that is we are not alone as educators. We are now part of a system and part of a community, and we need to keep on expanding and enhancing that community as we start to open these schools up. Next slide, please. So we're recommending that teachers continue to build this relationship with their students and their families. So the things that they've done over the last couple of months, online or virtually, or even going door to door, that should not stop when schools reopen, even if they're reopening on a hybrid model or on a virtual model or an online or even face-to-face. Continue that development of relationships, but also grow and nurture those connections between services and agencies. These relationships that people have developed between schools and their services need to continue. Next slide, please. And next slide. Now, in summary, there will not be one solution that fits every school. And so what we're also looking at doing is we're also looking at seeing how we can learn from others about what successes they've found. And it could be others from across the world, not just across the US. So we're seeking greater communication and collaboration. Next slide. And we're already starting to see this occur in the US. This is just an example of headlines over the last couple of weeks as schools start to prepare for reopening. We are seeing an understanding that health and education and health sector and education sector need to work together. There is this understanding that social emotional supports are going to be key. Next slide. And so to sum up, a couple of key points. Health and well-being are now, at least currently, core components of any school reopening, and we need to harness that relationship. Health and well-being are also being recognized by educators as being foundational. And health and well-being are also viewed by schools and their communities as not just being about physical health, though that is a key part. It's also about being focused around mental, social, and emotional health. So this is a time where we need to harness these relationships, build on this intersector collaboration. And as we say in that quote, we need to plan what our schools and what our communities will be like from here on. And this is actually an opportunity, though it's an opportunity that none of us actually wanted to occur. Okay, next slide, and I think that sums up. Thank you very much, Didier.
Thank you very much for this very impressive talk. You know, I think that the idea is that we do not have to waste this good crisis and probably take advantage of this crisis to think together about the question of Maslow and Bloom.